As a physical therapist, I've treated over 100 patients who've undergone a hip replacement surgery in 2025 alone. In this video, I'll share with you the 3 most common things patients have told me after a hip replacement, specifically the things that they wish they had known prior to going into surgery. One of the first things I often hear after a hip replacement surgery is patients will tell me that they wish they had done the surgery sooner. So going into the surgery, patients will often say they're concerned, they're scared, or even worried that going into the surgery and having it, they're going to still continue to have that same hip pain, that same dull, achy pain that they've had for months and years. However, after the surgery, once you get past that initial period of post-operative pain, so just the recovery from the actual surgery itself, once you get past that, they really quickly notice the difference in terms of that pain. It's all gone. So they always say, man, if I had known that the pain would change this drastically, I would have done it sooner. So the pain is typically better after the hip replacement, and patients will often say they wish they had done it sooner. The second most common thing that I'll often hear after a hip replacement is patients will tell me that they're so shocked and so surprised at how weak that surgery leg becomes after the surgery. So one of the main things that patients will notice after the surgery is they're going to have that inability of just lifting up their leg. So you'll notice this primarily whenever you're trying to change position. So for example, if you're trying to just get out of bed, so trying to lift up the leg to bring it off the edge of the bed, that by itself will be a task, and there's going to be some modification in terms of how you perform that because the leg is just going to be so weak. So a lot of patients will tell me that they're just very surprised at how weak that leg gets. So as a physical therapist, that's why we stress the importance of going into the surgery stronger, so then as you naturally will get weaker after the surgery, it's almost like that gas tank. The higher it is, the better you're going to have more of like that reserve in terms of that strength reserve. So you're naturally just going to lose a certain amount of strength, but if you go in there stronger, you're going to have a lot more reserve compared to if you don't do your prehab, if you don't do the strengthening to prepare for the surgery, you're going to have a much, much less gas tank and reserve of that strength. So the main takeaway that we try to tell a lot of our patients who are preparing for surgery is really work on strengthening that same side, that surgical side, before you have the procedure. It's going to make a big difference in terms of your function after the surgery. The third thing that I often hear after a hip replacement is patients will tell me they're also very shocked at how much they're compensating. So because how we talked about that surgical side, that surgical leg is going to be so much weaker, you're going to have to compensate somewhere. So where that comes from is there's going to be a lot of using of the upper body and arms, the opposite leg to help you stand up when you're trying to transfer or just change position, because you're not going to be able to initially use that surgical side as much as you like to. So that's why we also stress in terms of the prehab, it's not only important that you strengthen and improve the mobility and the overall muscular endurance of that surgical side, but you also want to make sure that your program includes strengthening for their full body, so upper body and your opposite leg, because then you're going to have that acute period in terms of that first 1 to 6 weeks of where you're just going to be relying a little bit more on your upper body and your opposite leg to help you perform a lot of your daily activities. If you found this video helpful, please hit the subscribe button to support the channel, and I'll see you in the next video.